Hey everyone, welcome back to the channel. I'm Christina and this is Speech Therapy Education. The topic of this video is treatment of articulation disorders. If you have not seen my video about articulation disorders and phonological disorders, I'm providing a link in the description below. Please watch that video prior to viewing this one because you will need to understand the difference between phonological disorder and articulation disorder before you learn about treatment. If you were to look up treatment options for speech disorders right now, you might come up with a whole list of treatments like the traditional motor approach, cycles, metaphon therapy, minimal pairs therapy, and many others. So how do you know which treatment option to use? First of all, you have to understand if you're treating an articulation disorder, a phonological disorder, or even a motor planning issue. For the purposes of today's video, we are going to assume that we are treating an articulation disorder. Remember, an articulation disorder is a deficit in the motor production of speech sounds. Just as a side note, omissions and substitutions of a single sound can be phonologically based, so please make sure that you know it's an articulation disorder before proceeding with treatment. This is a quote straight out of the book, but I wanted to share it with you because I think it sums up how we should approach treating an articulation disorder. The question is never how many sounds are involved, but rather whether the errors, single or multiple, are articulatory or phonological in nature. If they are articulation-based, the best treatment option may be a traditional motor phonetic approach. So to treat an articulation disorder, we use a traditional motor approach. If you hear someone saying they are using a traditional motor approach, this is the same as saying you're using a phonetic approach. They are the same exact thing. A traditional motor approach is hierarchical. It is a step-by-step process and it's pretty straightforward and simple. I'm going to list the steps first and then we will dive in a little deeper. Here are the steps. A traditional motor approach is first comprised of sensory perceptual training known as ear training. This can be optional and I'll talk a little bit about that in a bit. The first stage is producing the sound in isolation, then nonsense syllables, then words, then phrases and sentences, and last, spontaneous speech. As we talk about each phase, I'm going to use an example sound. We are going to pretend that our client is having difficulty with the k sound. Since I work with little ones on a daily basis, this is a sound I'm treating all the time. We are also going to assume that the error is being substituted as a T, so the substitution would be T for k. So why is sensory perceptual training an optional stage? The reason why it's optional is because in order to work at this stage, your client needs to have metalinguistic skills. They need to understand that words are made up of sounds, and this might not be a skill that develops into the early elementary years. So before you even attempt this stage, think about how old your client is and if they have any auditory discrimination issues to begin with. If they don't have any auditory discrimination difficulties, then this stage might not be necessary. To do a quick check of auditory discrimination, this is something easy that you can try with very little materials. So I'm going to grab a piece of paper and I'm just going to write a T and a K. It might look something like this. And basically what you can do is tell your client, when you hear T, point here. When you hear K, point here. If they have trouble with the actual letters, you can always draw a picture to represent each sound and just say point to T and point to K. If you feel like this stage is necessary because your client has difficulty with auditory discrimination, I am going to provide a list of the stages in this treatment phase in the description below. The actual first stage of the traditional motor approach is producing the sound in isolation. There are 3 ways we can approach this stage: imitation, phonetic placement, and sound modification. In imitation, basically you tell your client, watch me and do exactly what I do. Say k. If this doesn't work, we can move on to phonetic placement. Phonetic placement is when we have to instruct our client on what they have to do with their tongue and their mouth in order to reach the target sound. To elicit the k sound, sometimes I use tongue depressors, and I put the tongue depressor on their tongue tip so it forces the back of their tongue up. Or you can just describe how to do it to your client, like put the tip of your tongue right behind your bottom teeth, raise up the back of your tongue. Another option is the sound modification method. Basically what this is when you use a sound that has similar features to your target sound that the client can produce in order to shape the target sound. For example, with k, a similar sound could be the sound. It's produced in the back of the mouth, just like k is. I will say I don't really use the sound modification for K, but I have used it for other target sounds. After the client can produce the sound in isolation with at least 80 to 90% accuracy, you can move on to nonsense syllables. This means that the client would produce the sound in a variety of syllable structures: consonant plus a vowel, vowel plus a consonant, and vowel plus consonant plus vowel. When targeting k, a consonant plus vowel structure might sound something like ki, ke, ko, ka. A vowel plus consonant structure would be ak, ik, uk, ook. For vowel consonant vowel structure, it might sound something like icky, achy, ooky. Basically, when I work on syllables with my clients, I tell them, we're going to make a bunch of silly sounds. Are you ready? Once you have at least 80 to 90% accuracy in syllables, you can move into words. As you're working through words, make sure you consider the difficulty of the words that you're presenting so that your client does not get frustrated. Some things to consider are the length of the word, the position of the sound within the word, the syllable structure, the syllable stress, co-articulation factors, and familiar words. I always like to use familiar words with my client because those are typically very highly motivating words for them, as opposed to words that they might not be familiar with. Now, once you achieve 80 to 90% accuracy in all positions of words, it's time to move on to producing the sound in phrases and sentences. Before you start moving into more complex sentences, you can start with simple carrier phrases, such as I see a cat, I see a car, I see a cake. If you're a new clinician, I want to take this time to share some awesome resources for you that have great word lists. There is a blog called Home Speech Home that has a ton of word lists. This was created by Luke and Holly, who are both speech pathologists. So Luke and Holly, if you are watching this, thank you so much for creating such an awesome resource. There are also lots of great apps like Articulation Station Pro and Word Vault. I personally use Articulation Station Pro, and it is awesome. My first year as a practicing clinician, I traveled to multiple buildings, so it was great to be able to carry just my iPad around instead of tons of articulation cards. I'm going to provide links to those resources in the description below so that you all can go check it out. Once you meet 80 to 90% accuracy in phrases and sentences, you are now able to move to spontaneous speech. Unlike the previous stages, once you meet 50% accuracy in conversational speech, it is about time to dismiss. The assumption for this is that the client's competency will continue to grow on their own. If you are unsure if carryover has been officially achieved, you can complete a reevaluation. This is often done with an articulation test. The most important takeaway from this video is that if you are asked by a parent or a client how you're going to treat their speech, I want you to feel confident in your answer. I want you to say that you know it's most likely an articulation disorder, which is a motor-based issue, and that you are going to treat it with a traditional motor approach. You're going to do this by working on the sound by itself, moving to syllables, to words, to phrases and sentences, and then to conversation. I am providing a link in the description below to a handout that you can use for your own personal reference. I hope you all enjoyed this video. If you have any questions or comments, please feel free to leave them in the comments below. Don't forget to like and subscribe to stay up to date with future content. Resources used for the content in this video are provided in the description. I hope you all have an amazing day.